Good day, ma'am. I am Marjo Rivera, a student nurse from University of Northern Philippines. May I know your name and age, ma'am?
Hello sir, my name is Jamie Cacho, 20 years old.
Okay. So today, ma'am, we are going to perform incentive spirometry. So what is incentive spirometer, ma'am? So incentive spirometer is perfectly normal after a major operation to experience a pain and discomfort to your tummy. Sadly, this does mean that doing simple things like taking a nice deep breath can take a little bit uncomfortable. However, it is vitally important after your operation that you are able to keep your lungs nice open and clear to prevent further complications such as chest infection. To ensure that the breaths you're taking are deep enough, you will be given an incentive spirometer, which is in here at our table. So, incentive spirometer comes with a little bag in two pieces. We have the straw that attaches down here at the base, and if it's dirty, you can unassemble and wash it with warm soapy water and let it dry before inserting it. So, when using it, you need to sit up straight in a chair or bed, or standing straight, whatever you're comfortable with. Hold the incentive spirometer at eye level, or if you had surgery on your chest, abdomen, or your belly, hug or hold a pillow to help splint or brace your incision or your surgical cut while you're using the incentive spirometer. This will help decrease your pain at your incision. So, you need to hold your incentive spirometer at your eye level and put the mouthpiece into your mouth and close your lips tightly and slowly breathe out and take a strong breath in and hold it for 2 to 4 seconds. Lifting up as many balls as you can, and you're aiming to lift up all 3 balls, but don't worry if you can lift 1 or 2 balls, it's fine. And if you lift balls and hold them up, you're giving your lungs a nice chance to open up and fully expanded. So I will be demonstrating on how to use it. Pull the straw and then slowly breathe out completely, and then insert your lips into the mouthpiece and inhale as fast as you can. Hold for 2 to 4 seconds while lifting up the balls as many as you can. Then after that, take a rest and do that 2 to 4 times. Now let's perform the procedure. Let's take the mouthpiece off and change another mouthpiece.
Kasi,
Alright. Now that you know the procedure, ma'am, do this 4 times a day. And all in all, this will help you to speed up your recovery period and get you feeling well sooner. That's all, ma'am. Thank you and hoping for your fast recovery.
thank you.
Good day, ma'am. I am Marjo Rivera, student nurse from University of Northern Philippines. Can you state your name and age, ma'am?
Hello, my name is Jamie Cacho, 20 years old.
Okay, Miss Katyo, in terms of setting up the equipment, the important aspects are ensure that the mouthpiece is inserted to the peak flow meter correctly and set the dial to 0. Now you've got your equipment set up, there's some important aspects or technique you should remember. These are to ensure that you sit up nice and straight, to take a nice deep breath. as far as you can. And ensure that your lips are sealed around the mouthpiece and breathe out as hard as fast as you can. Okay, I'm gonna demonstrate. Then, look at the reading on the peak flow meter. Do you understand the procedure very well, ma'am?
Yes, sir.
Okay, can you repeat what you've learned so far?
Okay, sir. So the first one is to make sure that the mouthpiece is inserted correctly to the peak flow meter and the dial is set to 0. And then make sure to sit upright to breathe in as far as I can. And then also make sure that my lips are sealed into the mouthpiece and then breathe out as far as I can.
Okay, very well said, Miss Cacho. Now let's perform the procedure. First, let's insert a new mouthpiece. Perform the procedure. You did a pretty good job, Miss Cacho, by scoring 700. Let us take 2 more tests and we'll take the best of 3 readings and record in your peak flow diary. And thank you very much.